Tonight, the Oregon Health Authority says it is monitoring 4 people for Ebola. This comes after they traveled to West African countries that are currently experiencing outbreaks right now.
4 people in Oregon are being monitored right now for Ebola symptoms. They recently visited African countries that are now having small outbreaks.
I hate to be the bearer of bad news, but there's this word of a new virus that is actually generating a travel warning.
Just a new update about Ebola, and it's a reminder, you guys, that the world is focused on COVID, but there are other infectious diseases that we need to keep our eye on. So here's what you need to know. Recent warnings from the World Health Organization about a new Ebola outbreak in Guinea. They're tracking at least 17 cases there. In the DRC, Democratic Republic of the Congo, there have been at least 8 cases, half of them fatal. The CDC recently issuing an alert to travelers saying that all travelers coming into the United States from those areas will now be funneled to 6 U.S. airports and tracked once they arrive here. And the CDC also issuing a recent level 3 travel advisory to both of those areas, saying if it is necessary to go there, they are recommending Ebola vaccination for anyone having to travel there.
Okay, hearing Ebola, just hearing that name again, and also as deadly as it is, there's still some upside. We have some advantages because of the way it behaves.
And you're thinking like a true doctor now, TJ. The reason for that is that in general, with the more deadly a virus is, it is actually easier to control. People don't walk around asymptomatic usually with Ebola like they do with COVID, but we will be tracking this because they've had a problem with it in the past. We want to make sure it doesn't become another problem now.
Ebola, a deadly virus, is now a concern in Oregon. The state health authority today revealing it is monitoring 4 people who may have been exposed during travel to
Health officials are keeping an eye on 23 people who recently traveled to countries with Ebola outbreaks. Health officials have been in contact with these people who recently traveled to West Africa. They're being asked to check in daily for 21 days to make sure they're not experiencing any symptoms. So far, no one has tested positive for the Ebola virus, and the Department of Health says the risk to people in Washington state is low.
The good news is OHA says this poses a low risk for Oregonians. It says those 4 people right now are asymptomatic as it continues to monitor them.
While the risk to Oregonians is low, the Oregon Health Authority wanted to make sure it provided reassurance to the community.
Ebola is scary, and so we didn't want the media, we didn't want the public to think we're holding anything back. That's not what we do. But we also think it's important that people understand that the risk is very low. This is not a big deal, and public health is basically taking steps to keep it that way.
Dr. Richard Lehman with the Oregon Health Authority says it's working to determine if the 4 people have been exposed to Ebola and are periodically checking in with them to check for symptoms. It's not releasing which counties these people are from or any particular details around their visits for privacy.
Release of very specific information could lead to people actually being identified, and this could damage our ability at public health to work with these folks effectively, and it could also expose them to unwanted attention or even persecution, and I think we're all agreed that's not something anyone wants.
Now, on March 4th, the CDC required all airlines to supply it with contact information for all U.S.-bound travelers who've been in Guinea or Democratic Republic of the Congo in the last 21 days, which OHA says is the maximum known time between exposure and when someone has developed the illness.
Minimal risk, no risk, essentially, to people who were traveling on the plane with these folks unless the person became ill, because Ebola cannot be transmitted. A person can't infect somebody else when they are asymptomatic, when they haven't become ill.
Now, as we're in a pandemic, you may have some questions about Ebola versus COVID, and there's some important distinctions to make. OHA says COVID is spread through respiratory droplets and is more likely to spread than Ebola. OHA also says Ebola is spread if someone is exposed to the blood or body fluids of someone who's ill with Ebola.
And OHA says it's also in contact with groups who serve communities that are at higher risk of exposure to Ebola due to traveling to those regions.
Those 2 countries are experiencing a small Ebola outbreak. As of March 24th, Guinea reported 18 Ebola cases and 9 Ebola-related deaths, while the Democratic Republic of Congo reported 12 cases and 6 Ebola-related deaths. Dr. Richard Lehman with the Oregon Health Authority states that none of the 4 people are showing any Ebola symptoms, but they will be monitored for at least 21 days. Lehman will not disclose which counties these people are currently in or what they were doing in Africa.
And I'm not going to get into specifics of each person, but basically we've got several groups of folks who might fall into this category.
He says the OHA is informing the public as a form of transparency, but does not want to give away any information about the individuals.
It's kind of a two-edged sword, right? I mean, you'd like to be able to tell everybody everything, but you really do need to think about what the consequences of that are.
COVID is spread through particles in the air, such as coughing, sneezing, and breathing, while Ebola is spread through the exchange of bodily fluids, such as being in contact with someone else's blood, sexual intercourse, or sharing food.
Ebola is just a lot tougher to get. It's a nasty disease. You don't want to get it, but it's a lot less contagious.
The Center for Disease Control and Prevention has issued a level 3 travel warning for Guinea and the Democratic Republic of Congo and recommends everyone avoid non-essential travel there.
Lisa, we hear the word Ebola, and it just sends shivers down your spine.
Yeah, even state health leaders said that today, that it's something that is very, very scary. But
Ebola often kills 50% of people infected. It's why the Oregon Health Authority wants the public to know there is the possibility the virus could be here.
Oregon Public Health is monitoring 4 people who returned from Guinea and the Democratic Republic of Congo in West Africa earlier this month, places where there are now Ebola outbreaks and deaths. What about airline passengers who wonder if they were potentially exposed to the virus? Ebola is less contagious than other viral diseases like COVID, because Ebola is not airborne.
Ebola is a highly contagious and often deadly virus. People suffering from the disease are only infectious once they develop symptoms. These symptoms appear between 2 and 21 days after infection, usually from 8 to 10 days. The virus targets the body's immune cells. These usually act as a first line of defense, catching and digesting infections. Normally, the immune system is able to boost its defenses to fight off an attack, but the Ebola virus manages to defeat and even destroy immune cells, often ultimately leading to death. Early Ebola symptoms include sudden fever, a general feeling of weakness, muscular pain, headaches, and a sore throat. The virus then attacks and damages cells protecting the blood vessels. This causes bleeding, dehydration, and abnormally low blood pressure. The liver is an organ where the virus can develop quickly, meaning patients often suffer from stomach pain, diarrhea, and vomiting. Some people also experience reddening of the eyes, rashes, hiccups, difficulties breathing and swallowing, internal and external bleeding to death.
Dr. Bill Messer says if a case of Ebola does develop in Oregon, healthcare workers are much better prepared to handle it based on experience treating COVID patients.
I imagine that we have learned so much since then about how to deal with these contagious and dangerous diseases that it sort of opened up a new way of thinking about, okay, if this is really an Ebola case, or if we really have an Ebola case, we're going to be so much better at I think, managing this.
And again, it's not something that's airborne. It has to be direct contact from person to person. What county, for example, I checked and found in Ohio, they have more than 40 people that they are monitoring right now who were in West Africa, and they did release what counties those people live in.
News. Governor DeWine has announced that 44 Ohioans are being monitored for possible exposure to Ebola. They recently returned from areas of Africa with active outbreaks of the deadly disease. So far, these 44 people are considered low risk for having contracted Ebola, but if any of them develop symptoms, they would need to be isolated and quarantined.
An Ebola outbreak in parts of Africa will now affect travelers coming into the U.S. Starting tomorrow, the Centers for Disease Control will require airlines to collect contact information of passengers coming from the Democratic Republic of Congo and the Republic of Guinea 21 days before they enter the U.S. Flights coming from those countries will also be redirected to 6 U.S. airports, including JFK and Newark.
Health officials now looking at 100 people in the Dallas area who may have had contact with Thomas Eric Duncan.
There could be additional cases who were already exposed. If that occurs, systems are in place so that they will not further spread Ebola.
As officials work to contain the spread of the virus, many are questioning, how did it get here? In Liberia, Duncan came into contact with an infected woman on September 15th. 4 days later, the 42-year-old was screened 3 times and showed no symptoms and was therefore permitted to board an airplane. But Liberian authorities now say Duncan lied about his Ebola exposure on a health questionnaire. He was asked if he cared for or came into contact with an Ebola patient, and he answered no. Duncan flew from Monrovia to Brussels, then boarded United Airlines Flight 951 en route to Washington, connecting to Flight 822 to Dallas. While the CDC maintains he was not contagious during his journey, United Airlines now voluntarily contacting passengers who flew on those flights.
In Dallas, Duncan stayed in this apartment complex for days before feeling sick and seeking medical care, only to be sent home from the hospital with antibiotics, even after telling them he had just traveled from Africa.
The hospital now admits they missed his travel history due to a workflow breakdown.
They were going to be monitoring all of us. My son should stay home, my nephews, every one of us should stay home for 21 days. And we should not come outside. If we step outside, then they're going to take us to court. They don't have committed a crime.
Health officials say the family hasn't shown any symptoms of the disease. Late Thursday, a special team was deployed to clean the apartment and remove items Duncan used. But they were turned away because they lacked the proper permit to transport hazardous waste.
Did the CDC recommend that you clean your apartment?
I told them you spray the Clorox on the mattresses on my bed, and I tie erect and dirty clothes are in the plastic bag, all sealed up, and that's it.
How are you?
Really helped us in linking with Nina and getting to know. Our patient, Nina Pham, is free of Ebola virus. We know that because we have multiple determinations of her PCR. She has no virus in her. She feels well.
Good afternoon. I feel fortunate and blessed to be standing here today. I would first and foremost like to thank God, my family, and friends. Throughout this ordeal, I have put my trust in God and my medical team. I am on my way back to recovery, even as I reflect on how many others have not been so fortunate. I do not know how I can ever thank you everyone enough for their prayers and their expressions of concern, hope, and love. I join you in prayer now for the recovery of others, including my colleague and friend Amber Vinson and Dr. Craig Spencer.
You must separate the issue of the risk to a general public with the risk with brave people like Nina and her colleagues. They're two different things. Nina put herself in a situation where she knew it was a risk, but because of her character and her bravery and that of her colleagues in the field, she happened to unfortunately get infected. That's a different story from the general public. She was with a very sick person. Going in the room, I'm just coming by to say hello. She taught me how to use FaceTime. When she was in Texas Presbyterian, she was in the process of actually doing better. She came to us and she continued to do better and better. We both supported her, so I can't pinpoint in one patient what was the turning point. The only thing that we're really happy about, that the turning point occurred.
A line is growing outside their destination, Freetown's Connet Hospital. The volunteers start showing up before dawn. They are healthcare workers. This trial is limited to them because they are by far the most at risk of contracting Ebola virus disease. Even though there is no evidence the vaccine poses any real danger, they must weigh the rumors and the uncertainties.
Life is all about risks.
Life is all about risks, but I believe it will be of help in the job that I do.
It is a high risk for me. I believe this can protect me from Ebola, and that is why I came here for this vaccine.
It wasn't always this way. The trial got off to a slow start when it began in April. people were too afraid. Dr. Mohammed Samad is one of the principal investigators.
People said the vaccine was the Ebola virus. So once you get it, you become infected. So a lot of people were not willing to come forward during the first week to take the vaccine because they thought they should wait and see what happens.
The vaccine does contain a piece of the Ebola virus, a protein. It's enough to trick the body into triggering its natural defenses, but won't give the recipient Ebola virus disease.
This vaccine,
I became aware of it through my friends who got the shot 3 days ago. Since they're not having any side effects, I decided to come and have a go at it myself, because I feel it will protect me.
Canu works on a team that buries the highly contagious dead. He has been shunned by friends, even forced out of his own home.
I will tell people
I will go back and tell them that I've had the vaccine and they should rest assured that I won't have the virus. I will probably encourage them to step forward as well.
The nursing team does not waste any time prepping for the jabs. Aruna Thorley is a chlorine sprayer who disinfects Ebola treatment units. Have you felt anything different? Did it hurt? Anything?
No different.
I feel the same as I did before. I hope and pray that it works.
The vaccine is made by Merck. The trial is a partnership between the Sierra Leone Ministry of Health, the U.S. Centers for Disease Control and Prevention, and the Medical College in Freetown. Across the border, in Liberia, a separate trial is testing the same vaccine along with another one made by GlaxoSmithKline. It is open to all and based at this hospital in Monrovia. The trial is run by Liberia's Ministry of Health and the U.S. National Institute of Allergy and Infectious Diseases. Its director, Dr. Anthony Fauci, has intense, intimate understanding of the ravages of Ebola.
At least in the most recent patient that we took care of, that's about as sick as you can get without dying.
On March 14, 2015, he suited up to treat a U.S. healthcare worker who became infected in Sierra Leone and was airlifted to the NIH hospital outside Washington, where he received the highest level of intensive care possible. It kept him alive while his body mounted its own defense. It was touch and go for a week, but he survived.
All of the people who have recovered from Ebola, even those who've been very ill, it was their immune system that ultimately suppressed and eliminated the virus.
This is why Fauci and others are optimistic they have found a way to stop Ebola in its tracks. The human body can create the antibodies to fight off Ebola, but usually not fast enough. An effective vaccine creates an army of Ebola antibodies that can stop the virus before it stampedes through the body. But here's the ironic rub.
If we are successful in controlling Ebola, we won't be successful in determining whether the vaccines are effective at preventing Ebola. So the trials underway now will at least tell us whether they're safe, and they will tell us whether they lead to an immune reaction. We wish we were further along with the vaccine, but it's very difficult to do research in the middle of an epidemic.
Thus, it is clear that though there have been some instances of people alleging side effects of COVID-19 vaccines, the claim about the vaccines turning people into zombies is baseless. A morphed screenshot with CNN logo is being used to spread rumors about people in the US turning into zombies after getting the COVID vaccine shot.
The CDC is giving official, sanctioned advice on how to survive a zombie apocalypse. This after online predictions say that 2021 is the year it could happen, and of course the internet is always right. Health experts say having emergency supplies, a plan of where to meet in case zombies overrun your town, and an evacuation plan, they're all important. Now these tips started coming in tongue-in-cheek as a joke, but the CDC says it's actually a great conversation starter about preparing for any type of crisis.
Because apparently the CDC has put out new guidelines, tips on sharing and surviving, I should say, a zombie apocalypse.
You did this story like 3 days ago, though.
Okay, well, it's back. They're telling me that we need to do it again, Tucker. So I'm just taking direction, right? So maybe someone spotted a zombie.
You sold it to me, Holly.
So Nostradamus, you know, he actually predicted in 2021 that there would be a Russian scientist create a biological weapon that will produce a virus and turn humankind into zombies.
Okay.
Yeah, and then the human race will end as we know it.
The government is trying to prepare us for this. A zombie apocalypse. The infamous astrologer Nostradamus predicted something like this could happen in 2021. Specifically, he said a scientist is going to create a, quote, biological weapon that will bring the dead back to life. CDC says, well, that's not likely to happen, but just in case, the agency wants you to be prepared.
Now, this is very bizarre. Questions about a possible zombie apocalypse make for a lively topic on social media.
The CDC made a tongue-in-cheek reply by issuing tips on how to be zombie-ready in case of a sudden outbreak. They say treat it like any other disaster by preparing an emergency kit. Next, they recommend that families come up with an emergency plan. And according to CDC officials, if zombies ever did start roaming the streets, the agency would conduct an investigation, much like one for any other disease outbreak, providing technical assistance to cities, states, international partners dealing with a zombie infestation.
The zombie apocalypse. This isn't some really bad B movie. It's an actual scene from the 2012 Counterterrorism Summit attended by law enforcement officials around the country. Summit tickets, $1,000 a pop, paid for with your tax dollars. The zombies look scary, but organizers say the skit was solely to add levity to an otherwise serious meeting on protecting the homeland. Senator Tom Coburn says it's just another example of more than $7 billion in questionable homeland security spending every year.
It's blown. Wasted.
In a new report, Coburn cites example after example, including nearly $30,000 for an underwater robot in Columbus, Ohio, the $69,000 hovercraft for Indianapolis, and this, the sleepy town of Keene, New Hampshire, citing the need to secure its annual Pumpkin Festival, was awarded a grant to buy a Bearcat armored vehicle, price tag nearly $250,000. Department of Homeland Security told us its grants, quote, make our communities safer places to live. Coburn says there's just too much waste.
So the examples you cite here are the tip of the iceberg? Sure. All over the government, everywhere you look. Is what? Is waste, incompetence, and stupidity.
Then again,
If you're the kind of person who strategizes about how to survive The Walking Dead, this could be crucial life-saving information. Researchers have rated the best and worst cities in the case of zombie apocalypse. Economic Modeling Specialists International ranked cities on their ability to defend against a zombie attack, stockpiling food, containing zombies, finding a cure. And if you live in New York City, hate to be the bearer of bad news, but you're toast. The city got the worst rating, followed by Tampa, Los Angeles, Riverside, and San Bernardino, California. Southern California really stinks. And Chicago, so the nation's 3 biggest cities, right? Best place to be? Boston. The city was rated as the place you most likely would survive. Other contenders here, Salt Lake City, Columbus, Ohio, Baltimore, Virginia Beach, and Norfolk, Virginia. But, I just have a problem with this, right? Here I live in New York City, and I will admit that Manhattan may not be the best place to survive a zombie apocalypse. Number one, the food is going to go really fast. Number two, they can climb stairs. And as everyone knows, your buildings go up really high. But think if you live in Brooklyn, also part of New York City, or Staten Island. You could contain the threat to Manhattan and still have lots of farmland to grow food.
It's time to get that daily news. I ain't watching TV, I'ma log on to YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Talking about that raw, uncut news. You a fool. You believe that mainstream and local news. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. And 411, keep the 411. On a sensitive subject, keep it 100. Don't bite no tongue. If you cannot take the truth, then this is finna hurt. Who's to say if it's a round or a flat earth? Stick to the facts, what's some feelings? I don't do no capping. Read that paper, seen that news, now you know what happened. Playing a pretty picnic, they control that weather. Same crisis actors, like we don't know no better. Thing about the truth, always come to the light. Pile of me is too many, all bark, no bite. Like muscle, no might. I don't know what happened to them, but I know the way they said, somebody ain't right. It's time to get that daily news. I ain't watching TV, I'm a log on the YouTube. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Talking about that raw, uncut news. You a fool, you believe in mainstream and local news. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe.